a couple of questions. You had mentioned that there's a section that you view as unconstitutional. Is abortion mentioned anywhere in the U.S. Constitution? I'm not questioning whether you think that section is, but is abortion specifically mentioned in the United States Constitution or the Constitution of New York?
No.
Okay. I was just curious about that. You said that there is a ban on partial birth abortions, which we know that there is, but yet in this procedure that would take place beyond the 24-week mark, maybe up to the 9-month mark, not to be too blunt, but how else would you terminate that pregnancy without part of that child exiting the womb?
Well, since partial birth abortion was not actually a medical medical term, it refers to a specific procedure called intact dilation and extraction. So that was the procedure was banned. There are other medical, I'm not a doctor, but there are other medical means for, in the case of the life or the health of the mother, where that pregnancy can be terminated. And in some instances, it may actually be necessary because the fetus is not actually alive and is killing the mother.
Understood. However, what you're saying to me is that partial birth abortion is what? A commonly used term, I guess you'd say, right?
It's a shorthand that people in political life use.
Right.
But I was trying to say, and maybe I wasn't clear enough, that there was a specific procedure, a medical term called IDX, intact dilation and extraction. That is what we lay people have referred to as partial birth abortion.
Yes. And what would that be? Intact dilation extraction. What would that be?
It's a banned procedure.
But what would the procedure be?
I'm not, a doctor. I'm not a gynecologist. So I can't give you a specific description of how that is affected.
Okay. So you've used the term a few times, but you don't know what it means?
No, I refer to a term that has been used widely in political terms. I am telling you that it is, in fact, from a medical terminology, it would be called an intact dilation and extraction.
Right.
The fact that I don't know how to perform one is not relevant.
I didn't ask if you know how to perform one. I asked if you knew what it was, since you've used the term repeatedly. And I guess you don't, but I do. It's a surgical procedure that removes an intact fetus from the uterus. The procedure is used both after late-term miscarriages and in late-term abortions. So that would be the extraction of an intact fetus. But I think anybody with any common sense would understand that removing the baby up to its shoulders and then scrambling its brain would also be a partial birth abortion. I think that it's a pretty commonly used term, and I think everybody kind of understands what a partial birth abortion is. Whether it's completely intact officially or not, that's like saying assault weapon. There's really no assault weapon, but it's a commonly used term. Ms. Glick, is there any instance that you can point to medically where it would be safer to terminate a pregnancy in the last month or right up to the moment of birth? Is there any instance where it would be safer than performing a cesarean section. Whether that child was still alive in the womb, I think even you'd consider it to be alive, or whether that child had passed away. Is there any instance where it's less dangerous to the mother to do that than to perform a C-section?
Well, there
Any.
may be.
Just
but
one.
Mr.
Ms. McLaughlin, you will wait for her to answer, please.
There may be, but that is why we put this in the hands of qualified medical professionals who understand whether or not a woman's life or health is in danger. If there is, I suppose, a rare instance where it is a question, they would call in a consultation and they would make a decision. I would think that if somebody were, and many women who have who have cancer, are in late stages, many women choose to delay their treatment in order to effect a live birth. And so that is their decision, to make their decision to determine whether or not their life, their health, what's most important. They get to weigh that. And they get to do that in consultation with their family and qualified medical professionals. This bill is attempting to ensure that it is medical professionals and the woman and whoever she chooses to consult with, be it a religious advisor or her husband, to make a decision as to whether or not to continue, even though her life or health may be at risk. And there are women who certainly make that decision. Many women make that decision. But we want that decision to be in the hands of the individual families and the medical professionals they consult with.
Certainly understand that. Not my question at all. My question actually was, do you know of any instance where it would be safer to do a partial birth abortion versus do a C-section?
There is no partial birth abortion, so I don't know how I can be clearer that it is banned.
It is banned, but let's just agree to disagree that when a baby is partially out of the birth canal, I think most people would assume it's a partial birth abortion if that baby is in fact terminated. You talked about when the baby takes a breath. You believe, I think, that until that baby takes its first breath, that it is afforded no rights? Is that what you stated?
No, what I stated was New York State law.
Okay. You stated New York State law. So if a baby is born intact and alive but has not yet taken its first breath, it has no rights? Is that the position that you are taking? Or would you
New
like
York
to...
State law
Yeah.
says that you are alive when you begin to breathe. That's not me. That's just the law. And I'm, I don't know if you're an attorney, but I'm not. So I'm just going by what is state law.
Do you think, Ms. Glick, that maybe we should change that law, and that maybe a baby that might be born in distress, and maybe its lungs are clogged, and maybe it needs the suction, maybe that baby should be afforded rights? Should we talk about changing that law?
Well, I think what we have currently are disciplinary actions against doctors who don't take every effort to ensure that any fetus born that is then having problems, they do try. I mean, I think it's one of those traps that we get into. I'm not saying that they don't deserve rights if they are struggling for breath. There are many instances when a newborn is having a problem, and doctors provide but those are medical instances. There aren't any people in that situation. Nobody is sitting there with a law book saying do this or do that. There are medical professionals whose impulse, whose license is dependent upon, who would face disciplinary action if they did not follow appropriate medical procedure.
No, Ms. Glick, they would not. Because you just stated that New York State law says the baby has no rights until it draws its first breath. So in fact, they would not be prosecuted. I believe that every single one of them would try to help that baby. Unless, of course, they were there to perform an abortion, then I'm not so sure that they would. But the fact is, and again, I would ask you just to answer my question. Do you think we should change the law that says that that baby has rights? Do you think we should change that law, yes or no?
Well, you get to ask the question. You don't get to tell me how to answer it.
Well, I'd just like an answer that relates to my question.
Well, my answer is that a person in New York State, and therefore afforded all rights, is born and is alive. And I don't think we have to change anything in New York State law to protect the baby that is born and is alive. And I will tell you, as chair of the Higher Education Committee, where we deal with the State Education Department, yes, doctors who do not follow all appropriate medical procedures to deal with a newborn that is in distress very well could face serious sanctions. So I disagree with your premise.
What's my premise? My premise was simply to ask you whether the law should be changed, that when a baby has not yet drawn its first breath, but is completely out of the mother's womb, whether that baby has rights. That's my premise. That was my question, which you don't seem to
Born
answer.
and is
other
alive.
Than to say you
Born
don't
and
think
is
the law
alive.
needs to be changed.
Born
now,
and
Ms.
is
Glick,
alive.
when
That
a
is the
baby
law.
is inside its mom and is kicking, do you view that baby as alive?
New York State says born and is alive.
Okay.
That's a person.
Uh-huh. If a doctor is operating in utero, which is now possible, and you've seen the pictures of a baby's hand gripping a doctor's finger, is that baby alive, and is that baby afforded any rights? If that doctor botches that operation horribly, is that doctor going to be prosecuted for medical malpractice or not because the baby has no rights?
None of what you're suggesting changes the law.
Yeah, I know that. I'm asking you, again, whether we should visit that law and maybe start thinking about the fact that those babies are alive.
I'm here to discuss the bill in chief, not
Well, it's
a number
interesting.
of hypotheticals that
Ms.
are actually.
It's funny how you don't want to talk about the hypotheticals, except for the fact that you brought it up. I'm simply talking to you about taking a breath, which you brought up on your own. So you can't not talk about the hypotheticals when you brought them up, just because it's uncomfortable now to talk about the hypotheticals.
Was there a question? Was that a question or a statement?
Mr. Speaker, on the bill, thank you.
On the bill, Mr. McLaughlin.
I think I've made my point here that these children are in fact alive. I believe this is an expansion of abortion. I believe that there is virtually no circumstance where it is safer to do a partial birth abortion, even though you don't like that term. That's what it is. That's what it's commonly referred to, because that's what it is when a baby is partially out of the birth canal. You may not like that term, but that's what that is. I know this is an emotionally charged issue, but there is almost no circumstance ever, medical doctors will tell you this, that it is always going to be safer in almost every single case to do that cesarean section and give that child the care that it needs. So for very obvious reasons, Mr. Speaker, I urge a no vote on this one House bill which is going nowhere. Thank you.